typically and historically, it's been a problem for all of our children who are under the age of 2, and they come in with pretty severe respiratory illness. They have tachypnea, they can't breathe because their kind of faces and sinus passages are so small. The mucus they produce kind of blocks up the passages, and then they need frequent suctioning and oxygen and things like that to just get them over that infectious period. We have had a pretty dramatic shift in our RSV season. It used to be a wintertime virus where hospitals would expect large amounts of children to come in with RSV, and then we would kind of get over that wintertime hump. Since COVID-19 and kind of universal masking, we completely saw no RSV basically in 2020 and in our 2021 season. RSV showed up in the summer when we were all not expecting that at all. What we're seeing now, we still had some a small kind of RSV bump in this summer, but like across the country now, we're having lots and lots of RSV show up into the hospital, to the point that in Connecticut, they had to call the National Guard to kind of help with all of the admissions. And so the problem, just like with COVID-19 in early 2020, like if you have any one thing kind of overwhelming your hospital with admissions, it takes away hospital beds and for other things that we need to help with.
I have to point out, a lot of people don't know, but RSV affects adults too. Something like 170,000 adults get hospitalized every year with RSV, primarily the elderly, primarily those with underlying medical conditions, but it can cause pneumonia in older adults just as it can cause problems for young children. So a lot of people don't know that, but RSV can also impact older adults.